you very much, Lisa, and good afternoon, Community Action, and welcome to today's Decreasing Family Homelessness webinar presentation. You are in for a treat. So we're going to be focusing on embracing innovation and developing partnerships to end homelessness, the role of community action agencies, and what we know as community action agencies is that we often are involved in community coalitions, or we are community conveners with other partners, and so I imagine many of you are maybe a part of continuums of care or other coalitions that are meeting the needs of the homeless population in your local communities, and so look forward to hearing some best practices around that, the ways to really maximize that for us as a network, and also to hear from the field, from your peers and colleagues about what that work looks like on the ground. And so I am pleased to welcome our presenters who are joining us today, Michelle Flynn from The Road Home, Jennifer Godfrey from Utah Community Action, Sharon McDonald, who is our subject matter expert from the National Alliance to End Homelessness, and her colleague Jen Sanders from the Alliance as well. And so as we think about this whole notion of the learning community, in particular our topic area being ending or decreasing family homelessness, there are many dimensions or barriers for families and individuals who are threatened with the possibility of being homeless, and then of course those who are experiencing homelessness itself. And so, you know, as we think about this this location for individuals, we as the Community Action Network play a critical role, and really it's just rooted and grounded in who we are, in our own mission as a network, and I think the promise really says it best, and we will look at that promise collectively as we kick off today's presentation. And that promise says community action changes people's lives, embodies the spirit of hope, improves communities, and makes America a better place to live. We care about the entire community, and we are dedicated to helping people help themselves and each other. And so today's webinar is a webinar sponsored by the Learning Communities Resource Center. And really our intent as the LCRC, or the Learning Communities Resource Center, is to build the network capacity to fight the causes and the conditions of poverty more effectively, and to do so utilizing promising practices. And so today we'll hear about that innovation or those creative strategies that are happening on the ground to strengthen those partnerships related to homelessness, because at the end of the day, our end goal is to fight poverty. The anti-poverty work is the heart of what we do as the Community Action Network. And so with that said, it is my great pleasure to introduce to you all again our presenter, our first presenter for today, who will then introduce our remaining panel members. Jen Sanders, I hope I'm saying that last name correct, Jen. If not, please forgive me.
Thanks, Tiffany.
Yes, Jen is Senior Program Analyst at the National Alliance to End Homelessness, and really she focuses on issues related to rapid rehousing. Prior to joining the Alliance, she worked as a Senior Program Officer with the National Academies of Sciences and Engineering and Medicine on issues ranging from homelessness to urban sustainability, veterans health, and environmental health. And so we are so grateful that Jen has joined us today. She is a graduate of George Washington University, holding a Master's of Public Policy and Public Health. And so we have an expert in our midst. And with that said, I am going to stop talking and just say thank you, Jen, and welcome again for leading us in today's conversation.
Thank you so much, Tiffany. So I just wanted to take a moment to introduce the topic today and the panelists that she mentioned. If you could go on to the next slide. Thank you. So as you'll hear today, Salt Lake City has been on the forefront of addressing family homelessness and piloting innovative approaches. And in doing so, it's become a national model. So during this webinar, you'll hear how Utah Community Action in Salt Lake City has developed strong partnerships with the local homeless system and implemented some innovative approaches such as diversion to address family homelessness. Our presenters today, as Tiffany already mentioned, Michelle Flynn with The Road Home and Jennifer Godfrey with Utah Community Action. Following their presentations, we'll do a Q&A, and I will give a very brief overview of HUD's 2017 Continuum of Care Program, NOFA, and then Jared Thompson, who is a program associate with National Alliance to End Homelessness, will talk to you about some of the advocacy efforts that we currently have underway. So that's really all I wanted to say, and with that, I'll turn it over to Michelle.
Great. Thank you, Jen. And I just want to say I'm excited and pleased and honored to be asked to present on this particular topic. Here at The Road Home, we've had a long history of working closely with our partners at Community Action and feel that that partnership is key to ending, certainly, family homelessness in our community. The next slide shows the mission statements of both The Road Home and Utah Community Action, and we thought it would be good to put them together to show how much we're in sync with each other in terms of the population we're serving. Our goal is to help people get back into their own home as quickly as possible, and Utah Community Action has so very many programs around strengthening families and really creating a support system to help families remain stable in the community. So I'll talk first a little bit about The Road Home, just to give you a background of who we are and the services we provide, and then talk about how we partner particularly with Community Action. So on the next slide, you will see that we have a number of different programs which we've summarized into three main categories. Housing in, well, first of all, we're a 501c3 nonprofit organization that's been in Utah since 1923. We actually started as a Travelers Aid Society organization, and we mainly were operating emergency shelters. Back in the early 2000s, we transitioned and changed our name to The Road Home to better reflect our mission and to drive our services towards ending a family's homelessness as quickly as possible. So our three main categories of services, the first is our housing engagement services, and the items that you see highlighted in green are those areas that we have strong direct partnerships with Utah Community Action. So prevention and diversion, we'll talk a little bit more about those programs later. We provide a Housing First-based emergency shelter system for families as well as single men and single women in Salt Lake County, and a variety of crisis services, all geared towards engaging with people to start their path back into their own home. We then have housing navigation services. We work with our community and coordinated entry program in Salt Lake. The Road Home really focusing on doing a coordinated process for families who are homeless in Salt Lake County to engage with and get enrolled in rapid rehousing and other family housing programs, and also for veterans and chronically homeless individuals. We have a strong team that works with landlords that gets to know the community property managers, locations of apartments, and really works hard to engage landlords in working with our population and helping folks get approved for housing as quickly as possible. And then a big part of what we do is the housing stability services, and there are many ways we partner with Community Action in this area. At the Road Home, we operate a family rapid rehousing program. We have a Pay for Success program, which is a new program we just launched targeting single individuals. And then we operate with both property management and supportive services, a number of permanent supportive housing projects. We have an overriding philosophy of housing first. So throughout all of our programs, we want to engage quickly with families and individuals, and we want that client-driven decisions to be made, moving people as quickly as possible into housing and lowest barrier and into shelter and into housing as possible, and then provide the supportive services to help that household remain stable in the community. We also are working toward a very trauma-informed agency. We want all of our services to be provided in a trauma-informed manner. We recognize the trauma that our individuals and families have been through when they end up in our system of homelessness, providing homelessness assistance, and we want to make sure that we are being following all those protocols and making sure we're not re-traumatizing folks, but instead helping to support them become more able to make those decisions and move on out of homelessness. The next slide shows just some numbers that give an overview of the number of people we serve. So in fiscal year 2016, we helped over 11,000 people through all of our programs, a little over 8,000 in emergency shelter, including 764 families with over 1,500 children. We provided over 3,400 individuals with a variety of types of supportive housing. And on any given night, we have more people in housing than we do in shelter. And that's our goal, to really grow the housing and reduce the need for emergency shelter in our community. Over the last 10 years, we've seen double the number of families in emergency shelter over 10 years. From 2015 to 2016, we had an 18% increase. And so far this year, we've had a much lower increase, and we'll talk about that a little bit more when we talk about diversion. The next slide shows just an overview of homelessness in Utah in general. So these are information from our state that runs our homeless management information system, showing the number of individuals that are experiencing homelessness on a given night. And in 2016, we had just over 1,800 homeless individuals, 979 persons in families with children. You can see on the right-hand side the housing inventory that we're working with, and we have about the same number of emergency shelter beds as permanent supportive housing beds in our community, and just over 1,000 rapid rehousing slots at a given point in time. We do have some transitional housing, but it's a small part of the picture of housing for individuals and families leaving homelessness in the state of Utah. So why partner? Why partner with community action programs? I think the road home, well, first of all, we are very lucky in Salt Lake County to have such an incredible high-quality learning organization like Utah Community Action. The Community Action leadership has been strong in coming together and partnering. When this leadership team that's there, which includes Jen, took over a couple of years ago, they really devoted a significant amount of time to meeting with partners, meeting with clients, meeting with many people in the community. From our perspective, they met numerous times with homeless service providers, really looking to see where community action was connecting with individuals experiencing homelessness, what gaps there were, and what types of needs from the homeless service provider's perspective could community action fill in their role in our community. And that was a huge shift for all of us. We had a long history partnering with community action on the basic programs that they provided, but we were able to brainstorm and really identify some areas that we could strengthen in our system with the help of community action. So at the Road Home, and I think here in our community in general, our homeless service providers really know our strengths. We know what we are strong where we are strong and we reach out to those other agencies in the community that have strengths in other areas that we need and bring them in to partner. So at the Road Home, we provide quality emergency shelter services, we help people get into housing, and we focus on rapid rehousing and permanent supportive housing. For other types of supports, we really want those other partners to be at the table with us. And so partnering is really key to any work and any successes that we have on a case-by-case basis and on the agency as a whole. We also really keep down the duplication of services and both to save resources and also to try and have a clear picture as possible to the community of how the system is working and what agencies are experts and what agencies are accomplishing in different areas of the system. Our goal, of course, is to reduce the length of stay of homelessness for families, and in order to do that, we need to bring those partners in that can help rebuild those support systems that disintegrated before the families came to our front door. The families that end up becoming homeless look very much like other poor families in our community. And we want one area that we know that we need to work on is to really build up a support system so when the family has an issue or another crisis, they know where to turn and can help mitigate that crisis without having to return to emergency shelter. In our family shelters that we operate, we really work on a philosophy of bringing in partners that can follow the families into housing. So we want to make connections while families are in emergency shelter, and we want those connections to be able to continue to support those families in their own home. We don't want to create, for example, an 8-week landlord-tenant training program that would require a family to want to stay in shelter for 8 weeks in order to complete that program. Instead, we partner with organizations that can come in and engage with families and start the process. We have Department of Workforce Services on site doing employment assistance, benefits assistance. We have community action on site, which we'll talk about in a number of different ways. We have healthcare providers coming on site that will engage the families and connect them with community health centers. So all support systems that will continue to work with families. Our view is that we don't want families to need to stay connected to the homeless system. We want them to leave the road home in their rearview mirror and not feel like they need to be connected to that system in order to continue moving forward in their lives. And that's my summary, and I'll turn it over to Jen to talk a little bit more about community action.
Thank you, Michelle. I just want to start by saying thank you for providing Utah Community Action the opportunity to share and truly highlight what we believe and view as a very successful partnership with our dear friends at the Road Home. And we have some exciting endeavors ahead of us, which we will touch base on a little bit later in the slides. If we can go to the next slide, I'm just going to highlight some of the services provided through Utah Community Action. And as Michelle had stated earlier, these are really services that we feel like focus in 3 areas with the intent of helping families become self-sufficient. So we have our 3 main areas are going to be health, education, and self-sufficiency. And we operate 6 programs as a whole. We have Head Start and Early Head Start services, and we serve 2,028 children throughout Salt Lake and Tooele County. We have adult education services, which are fairly new to the organization, and we do provide CDA certification so we can have those participants that work on those classes feed into our Head Start and Early Head Start program. We also provide ESL classes and GED. And then we also have an on-site culinary arts job training program, which we call Sauté, which feeds participants from that program into our kitchen and some of our other nutritional services program, which I'll briefly touch on. We operate a heat and weatherization program. In terms of nutritional services, we have a central kitchen, which is also a social enterprise for us, and it brings in about $400,000 in revenue a year. We have a farm that is associated with that, and we operate 4 of the county's largest food pantries. For the majority of today's presentation, I am going to focus solely on the services provided through our case management and housing department because that is where our homeless services also lie. So in regards to this department, we have holistic case management, which is modeled after our 2-gen case management approach in our Head Start program, because that's where we have found that we are truly the most successful. And we do a number of prevention services, and truly what we've been known in the community for 4 years is prevention services in the terms of rental assistance. But that has shifted over the last couple of years, which we are going to touch base on today. Some of those services being diversion, rental assistance, a landlord-tenant mediator, and then third-party eligibility, which we do in partnership with the Road Home. So if we move on to the next slide, this is going to provide you just with some overview of the agency. This is from our 2016 annual report. You can see that we served a little over 61,000 individuals. We're accessing services through our programs through a variety of capacities. We have a total of 533 staff, and our annual operating budget is about $23 million. So in terms of our housing and case management, that department runs at about $2.5 million in services that help us comprise some of these programs that we're going to touch base on today. And then I'm also going to talk a little bit about leveraging of dollars from our other programs to help support our efforts in the community. So in terms of housing and case management, we have a 50% success rate in placing unemployed clients into employment, and some of that is through our partnership with DWS or LSI, but also we have a number of them that are feeding into our own program through either our CDA program or our SAUTE program, as I touched base on. 82% success rate in assisting clients in obtaining and in maintaining safe and affordable housing. And as I mentioned, we have typically been known as prevention services in terms of rental assistance, but that has shifted quite a bit, and it's really evolved into holistic case management services, which I will share with you. 85% of clients who engage in services with our landlord-tenant mediator are successful in obtaining a mediation agreement, and this is a program truly that we are very proud of, and I think it is unique to our agency as well. And we are seeing that it is a benefit in a number of areas, not just with our landlords that we're working with, but this is an incredible service to our agency and the community. 47% of the families that we assess through diversion, we've been able to successfully divert. And I'm going to touch base on diversion a little bit later, but I wanted to give you kind of an overview of what was happening within the agency and the services that we're going to touch on. If we move on to the next slide, I'm going to walk you through kind of a timeline of what's been happening here at Utah Community Action. So we've been long-standing within the community since the 1965. Our housing prevention services or rental assistance started in the late 80s, and that truly is what we held steady and fast to until the last 3 years. Head Start Classrooms in 2002 was our really first partnership with the Road Home, in which we had a classroom that was based right outside of the shelter system. That classroom provided Head Start services to 34 children, but what we were seeing is on average about a 300% turnover from year to year. So we realized we were not truly establishing and building relationships with parents and children, and we wanted them to be more stable. So we knew then we had to take a different approach than what we were doing. In 2000, we launched the Housing Retention Program, and this program is also in partnership with the Road Home and then our local housing authority, with the intent, obviously, of providing case management services to help clients who have already received Section 8 housing or maybe some public housing maintain that housing, so we didn't see them circle back through the system. And that program is still going strong today. In 2009, I think we launched one of our most successful programs in partnership with the Road Home, and this is, which I will touch base on in the next slide, but this is also where we placed some Head Start and early Head Start classrooms within a permanent supportive housing structure, and we started to leverage some funding and circle back around to serving those families and children that were homeless. In 2014, Utah Community Action underwent a huge transition in regards to new leadership at the helm. So, and myself, of course, being part of that team. So as we know, with new leadership also comes a lot of changes, and so we wanted to start to look at changes as being an opportunity for us to really meet the needs of our community. So as we took on that new role, we were very serious about it and started to be reflective about the services we were offering as an agency. And what we noticed overall is that we were providing some very intentional and incredible programming. However, they were also operating very individually in siloed entities. So we really were not working collaboratively together, even within our own house. So as we started to look at the services, we realized we were creating a number of barriers. So for example, if we had a family that was accessing and receiving Head Start services, they had to go through the application process to also receive housing services or food pantry services. And so we were having participants do a number of applications time and time again, and we were not uniting those together and helping the family really stabilize and work on goals as one entity. So we started to shift how we were looking at our services in-house. And so we knew if we were having as many barriers placed internally, we were likely doing that as well externally for members within our community. So knowing that, we started to branch out and reach out to other organizations, our partners, our stakeholders, government allies, and really started to say, how are the services that we are providing, how is it working, with the intent of building stronger partnerships. And through that process, we learned that even, some of the services that we were operating in-house were likely better suited for other agencies. And so it also took a little bit of give and take on our part, where we started to shift some funds to our partners as well. And we started to look at what we were doing and figuring out kind of the lay of the land and where we needed to be. We were present in terms of we were in the community, we were there, we were seen, but we weren't always a voice at the table. And so as we went out and branched out to our partners and identified what their needs were and how they wanted us to better collaborate with them, we knew then that we also wanted to have a voice within the community in terms of what was happening, and especially what was happening for our clients that we feel like we are serving and partnering with so many entities in order to make that happen. So that was kind of the first overall shift of the agency. As part of that, we started to expand our case management and housing services in 2014, and what had typically happened is clients came to one service provider, one physical location downtown, and all services were conducted there. But what we did is we did some GIS mapping to identify where these clients were coming from and could see that there was pockets throughout our communities in which they were coming to. So we decided to be present and be part of that community. So we moved our services out from one location and expanded it to 6 locations throughout the valley with the intent of really helping clients access services in which the communities they live. So really, and if those services weren't there, our goal was to bring those services to that community so we could help better stabilize these households. In 2015, we launched our diversion pilot, of course, in partnership with the Road Home. And then we have our CIP partnership, which we also launched with the Road Home in 2015. And our most recent ventures are going to be our third-party eligibility into the shelter system, in which we are the third-party administrator at the family shelter for the Road Home. And then we have expanded our diversion services just recently to include single men and women. So if we move on to the next slide, Michelle and I are going to talk through a little bit about our partnership at Palmer Court and what that looks like. So I'll start by saying this was our initial launch into early Head Start services. As the Road Home was bringing on this project, they came to us and said, hey, we're looking at doing this, building this complex. There's going to be a number of families housed within this complex as well. Of course, there's going to be children involved in that, and we wanted to know how could we partner and what does that look like in terms of how can we best provide services on site for these children and families. So we have a total of 24 birth to 3 slots at that location and 17 Head Start slots, which are our 4 to 5-year-olds. This was the first model that we had done that was in this context, and it was also the first model in which we knew we wanted to provide extended day services and really beef up our parent involvement activities and engagement with our children and families that were there at Palmer Court. Michelle, do you want to add to that?
Yeah, thank you, Jen. This partnership that we have at Palmer Court has been such an incredible success. I think we at the Road Home feel like it's the most important thing we did for the families living at Palmer Court. The timing of this coincided with our community really investing in permanent supportive housing. So our Palmer Court apartment complex has families in one portion of the complex and single individuals on the other. It was our first venture into permanent supportive housing for families. We were targeting those families who had had multiple episodes of homelessness, often were multi-generational homeless, where we had young parents who were homeless themselves as children, and we really knew that they needed some surrounded with supportive services in housing in order to remain stable. We started looking, and when we were talking with the families about what their needs are, daycare came up a lot. So we thought, okay, let's figure out how we can get a daycare at Palmer Court. And after we explored it further and looked at what the needs were and what was available in the community, we recognized that Community Action had such a high quality Head Start program and was so focused on the family as a whole that would best meet the needs of our families. Also, as Jen said, we had the experience with Head Start right across the street from the emergency shelter. And with the families moving quickly in and out of shelter, some families would want to stay in the Head Start, but a lot of families would only get a brief time in that Head Start program before they moved out to an apartment in the community. And bringing the Head Start services to those families in housing instead of in shelter coincided with our philosophy of providing the supportive services for people when they're in the community in their own home and not creating everything in the shelter model. And I think we learned a lot. This was, was originally and continues to be families that have been through a lot of trauma, great trauma. The parents were nervous and hesitant about bringing their kids to a preschool program, dropping their kids off to what seemed to them an unknown situation. Many of our parents have been through severe trauma and abuse in their lives, and they cared very much to protect their kids from those types of experiences. So there was a great deal of safety in having the program on site and the parents being able to walk their kids downstairs to the Head Start classroom, volunteer in the classroom, and become engaged in all the activities that the Head Start staff were providing, connections to the community. It was really important and continues to be important that our case managers that are located on site at Palmer Court work closely with the Head Start staff and complement each other so that we are case staffing and knowing we're on the same page with the family-driven goals that they have. And bringing in different volunteer groups and addressing the needs of the families in a complementary way. So I will say it's a strong model. We have about 50 families at Palmer Court, and so they're mostly young families. And so the number of slots we have there works really well. Other homeless families can also attend classrooms if there are spots. But I'll speak for a minute also about the early Head Start, and that was something that quickly became apparent, that the early Head Start program was something that was going to be really crucial so that we could have siblings together and parents could have a centralized location where they got to know the teachers. And we changed up, the Head Start, I will say, changed up their program a lot in the way they administered it to the early Head Start kids and the Head Start kids themselves. But that has become just a really incredible place. And now that we've been open since 2009 and have had children who were born at Palmer Court, we're able to start an early Head Start as a baby and go through the preschool into elementary school is just an absolutely incredible experience to see what it's done for these kids and these families. So we look forward to, in our shelter system now, for families, we have a close collaboration with the school districts and work with the school districts and our case managers when a family moves into housing elsewhere, not Palmer Court, that we make sure that the family is connected directly with the Head Start that's closest to their location of their apartment.
Great, thank you, Michelle. I think, too, in regards to, as Michelle touched on, it was really important, and we saw a lot of collaboration with our case managers. Each of our families are assigned what we call a family advocate that is going to work closely with that family while they're with us for services. And as Michelle mentioned, a number of these families and children were with us for a duration of 4 to 5 years. And so that continuity of care was really strong. And what we found is that our case managers together from both agencies were really collaborating to ensure that we could surround the families with the resources that were truly going to best meet their needs and help them stabilize. And that also meant ensuring that the parents were not only protecting and providing for their most precious beings, but we were also being able to see great strides within our children and families that were receiving services at Palmer Court. So to this day, that is a very strong collaborative partnership that we intend to keep moving forward with for years to come. If we move on to the next slide, this is in regards to collective impact and what's happening here within our community, and I'm going to let Michelle share with you a little bit about collective impact and what's going on.
Thanks, Jen. So in our community, from the state level down, but really from Salt Lake County level down, are led by our county mayor, we moved into a shift in homeless service delivery where we wanted to pull together, and the mayor pulled together a diverse group of stakeholders, service providers, public officials, business owners, other key stakeholders to meet on a regular basis and really look at the system as a whole and how we could improve our outcomes. And so what were the performance measures we were looking at? How can we meet the goals that the community identified? And there are a number of goals that the community identified, but very much they are based on reducing the number of people who enter homelessness in our community, connecting quickly in a coordinated manner with those individuals and families, having them access emergency services immediately should they need them, and then keep the homelessness episode as brief as possible, help people into permanent housing, and reduce returns to homelessness. And so what we quickly realized with that group is that we needed a lot of providers at the table who were not typically part of the homeless services delivery system. And I think Community Action is a perfect example of that. Community Action helps prevent homelessness through all of their services that they've provided for many years. And as I mentioned before, many of our families who are living in poverty in our community look very similar to homeless families. And so we recognize that what Community Action was doing in the community to keep families out of the shelter system is the same thing that families need when they leave the homelessness system. So the Community Action services, education and schools, workforce services, all of those entities in the community that were so important are important to both prevent and to end and stabilize families who had an episode of homelessness. So we've been in that process for about 2 years. We've had great significant impact at the state level. The state, for the first time in anyone's memory, is putting some significant resources into helping improve the system to meet the goals that we set forth. That includes changing the entry process, increasing and funding diversion to reduce the number of families and individuals entering the system, restructuring our sheltering system to be smaller, more population-specific programs, and then really investing in housing, as we know that housing is the key, and we need to have the supportive services that are necessary, but we need to have the housing for people to be successful. And so we've seen some good strides, and we have a lot of work ahead of us over the next few years as well.
Absolutely. If we move on to the next slide, I'm going to share with you kind of how we ventured into homeless diversion and what that looks like and how it aligns with collective impact within our community. And they launched pretty similarly in time. I think we had started diversion up right before, so our efforts were known there, but it's really grown since then. So I first learned about diversion at a 2015 National Alliance to End Homelessness Conference, in which I had the opportunity to be in a session with Ed Boyd. And at that point, I came back and I sat down with Michelle at the Road Home, and I said, I've learned this incredible new approach, and I think we need to look at it in terms of what we are doing with some of our prevention dollars. And so we were very deliberate and intentional about building out a diversion system. That meant a lot of staff hours, a lot of very intentional planned meetings for our community so people could understand what we were trying to do. It took us about 6 months to launch the initial pilot because we wanted to ensure that systems were in place, our staff on both ends had the right training that they needed, and we brought in the best of the best, being Ed. And we started to look at what we were doing collaboratively and that we could build on, and how we were going to track systems, where were they going to be placed, how all of that was going to come into place before the launch of the system or the program. And we wanted to make sure from the get-go that we had the data behind it to support our efforts and what we were doing. So the initial launch of the program, we were only awarded $50,000 to get the program moving. And as everyone knows, $50,000 isn't a lot, but it was enough to get some other funders interested in what we were doing, and so we were able to bring in a private donation of an additional $75,000, which really got this program up and moving. Our partners at the table, obviously the Road Home, and then we had brought in 211, the LDS Church, and our state in terms of funding opportunities. And if we move on to the next slide, as the program launched in 2015, at the time of the launch, we were really looking at first-time families that were accessing the shelter system. And for that reason, we decided to position ourselves at the shelter door. We did receive a number of calls that came in from 211 and were routed to us, but we wanted to ensure that we were really meeting the needs of those that were homeless and were trying to access services that day or evening. And so we started with first-time families. Looking at the national trends at the time, we were hoping to divert 25% of families that we assessed. And then since our launch in November of 2013, we have assessed a total of 535 families, of which we were able to successfully divert 44% of those families, or 237 families. That is a total of 309 adults and 465 children that did not access the shelter services due to this program being in place. As we point out here, it's 774 shelter beds for that evening. And of course, we know once they get there, some may stay 1 or 2 nights. We have some families, obviously, that stay for a longer duration of time. And so as we started to look at this, we found that it was important for us to identify the strengths of those families that we were able to divert, and maybe some of the barriers for the families that we were not able to divert. So we could figure out if we needed to build systems around some of those areas of identified need. And what we saw, that 87% of those diverted had identified a strong social network, but oftentimes, truly, there was maybe a falling out, or they just needed to figure out how to better utilize some of the resources within the community in order to help them maintain where they were currently staying. So what we did is we really built up our mediation services, and that has been very successful in helping our families maintain their current living situations or go back to maybe where they came from. And so mediation plays a large part in this, and our landlord-tenant mediator also plays into this very well. 71% of those that we were able to divert reported having reliable transportation, which, as we know, it is one of the largest barriers that we have from our clients that we serve here at Utah Community Action, is transportation needs. So they had the means of getting back and forth, which meant that they had an opportunity maybe not to be at the shelter all day or to have the opportunity to go and find employment, to get their children to and from school. So we decided to really start to capitalize on some of those strengths that they were exhibiting. 71% of those also reported having some kind of potential income. And so what we did is we'd really sit down with the families. We used what we call, or what is the Arizona Self-Sufficiency Matrix, to identify needs for the clients. And that helps give us a starting point of knowing where we need to work with them and what resources are needed at that time to really help. With that, we were able to feed a number of our participants that were being diverted into some of our other services, whether it be our adult education programs, or maybe it was through our food pantry programs, or to provide the house in which they were going to, or the individual, their temporary home, heat assistance in order to help stabilize that household for a time. So really looking at how we could best support them with the services that we already have in-house, and then how we could also utilize and work with partners within our community. Our diversion program is experiencing a 15% recidivism rate, and so 52% of those that return to the shelter return within the first 30 days. So we know that first month is really imperative that we help stabilize those households, but it also means our staff have to be very intentional in terms of identifying needs for these families to ensure that we can provide as many supports as we can. And it also means being very intentional in regards to the families which we choose to divert. In some instances, we may not be able to divert families, although we would absolutely love to. So we need to be very mindful of that as well. If we move on to the next slide, this is going to share with you some of the projects that Utah Community Action and the Road Home have in the works. We have talked through a number of these, and Michelle, jump in whenever. So we talked a little bit about diversion analysis. So what resources are necessary in order to make our families more self-sufficient? We're going to dive into this a little bit more now here within our community as we're starting to see our families that are accessing the shelter system are more chronic. So we're trying to ensure that we have the right resources at the table, and are we putting our funding where it needs to be? We've also launched the diversion for single men and women, and we're starting to look at maybe what does that look like, what are the trends, what are we seeing there, and where is it we'd like to focus our energy.
And from our perspective in the sheltering system, we of course are looking to see how diversion is impacting the number of people entering the emergency shelter system. And we know there are many factors that affect that, and diversion can do a lot, but we also are experiencing about a 2% vacancy rate in our community, a high increase in rents over the last couple of years, and just other factors that are adding to a family's instability. So despite that, I mentioned earlier that we had doubled, the number of families coming into shelter had doubled over the last 10 years, but this year so far, we have 3 months left, but this year so far, the number of families coming into shelter is actually down about 4%. That's 29 families less than we saw last year. About 600 families we've served so far this year compared to 629 last year, year to date. And this is despite the issues that we've had that have only gotten worse in our community over the last year regarding accessing housing. And so we definitely can see some correlations, and part of what we'll do in the analysis is to see how we can best tell that story and increase the diversion in order to decrease the number of families coming into emergency shelters.
Absolutely. Michelle, do you want to touch base on the SAMHSA proposal?
So we're working on one of the things as Jen mentioned, we have been tracking the families who return after having been through shelter and out through our rapid rehousing program to try and learn a little bit more about what's happening with those families and see what we can do. Our success rate has been quite high over the years, up in the mid to 85 to 87% success rate of families who move through our rapid rehousing program and don't reenter the homelessness system. But over the last couple of years, we've seen that dip down a little bit, a little under 80% over the last couple of years. again, a lot of these factors in the community contributing to that. So one thing that we put together is we've designed a program where we would have a team, a support team, that when a family re-enters the sheltering system after having been through our rapid rehousing program, we can add another layer of support. We've always traditionally rehoused the family through rapid rehousing and often see success a second time, but we wanted to add another layer of support onto these families since they had already indicated a degree of instability. So we put together a program that we are trying to get funded that's a team of individuals that will both specialize in needs for the children as well as the adults. We know often when young parents have children with lots of complicated needs, they find it hard to navigate to get the children connected with those needs. So we have some children's clinical partners as part of the team. We also have community action as part of the team, not just through Head Start, but all the other programs that Jen mentioned. We think there's some strong connections to get the families involved in some of the different classes that community action provides, their job training programs that they have, their parenting classes. And so, and of course, we want to work side by side with them throughout the family stay. So we've got a proposal we're putting together that we're trying to get funded through a number of different sources. Right now, we're putting a request into the Substance Abuse and Mental Health Services Administration to fund that, but we want to get it funded whatever way we can.
Great, thank you. The next partnership that we have in place is with our weatherization program. So this is for our landlords. As Michelle mentioned, our vacancy rate here in Salt Lake City is very low. We're looking at 2%. So what we're really trying to do is build those relationships with our landlords. So what we are doing is we're identifying landlords that we have worked with in the past and we work with frequently in order to see, will they qualify for weatherization services, and how can we best kind of tit for tat, do a little bit of work for them, and then also have them help us shelter and house our families that we're both working with on both ends. So that's a fairly new program that we have in the works, and we're hoping to see that expand in this next year. We talked a little bit about the expansion of diversion for men and women, so that is a fairly new initiative, which we will see how that one rolls out here over the next little bit, but obviously with the intent to ensure that the shelter beds are there for those who truly are in need of them. We're also working on a transition plan for our clients that are receiving rapid rehousing dollars. So what the intent is that our case management services are able to work closely with the case managers at the road home to help them build and establish a relationship for case management and services prior to them transitioning off. We're hoping to engage clients earlier on to better stabilize those households and to see what supports and networks we can put in place for them prior to that transition coming to an end. Michelle, did you want to add anything on that one?
Yes, thank you. I think just a brief overview of rapid rehousing for those who are not familiar and sort of how we operated here. The road home provides a rapid rehousing assessment for any family either staying at our shelter or homeless elsewhere in Salt Lake County. And when families are eligible and want to enroll in that program, we help with barrier removal, such as paying debts to utility companies, paying for application fees to apply for apartments. We help the family locate apartments that work for them, that's in their area that they would like to live. We work with the landlords to help get the families approved for housing, and then we pay some deposit and some length of rental assistance. It's tailored, very flexible to the family's particular needs, and it comes with case management services. And we reassess every month whether that family needs additional services in a progressive manner. It's a progressive engagement model, a flexible engagement model based on the needs of each individual family. If a family needs additional assistance, we can add on rental assistance or case management dollars. And we also have a community team that meets each week that looks at the families who are in need of longer-term assistance and prioritizes based on vulnerability for the few permanent supportive housing options we have for families in our community. What we are trying to do with community action is to add to that progressive engagement model, where there would be a point where a family needs more supportive services, but not a full permanent supportive housing apartment. And we would be able to pull community action in more closely and transition those services from the road home to community action so that the family can really be working on housing stability and, as I said earlier, leave the road home in their rearview mirror and move forward with their lives. And so we've attempted to fund this a couple of times, and we're determined to keep trying to do it because we think it'll be just a really great addition to this progressive engagement rapid rehousing program.
Absolutely. And as Michelle said, we are determined to see that this happens within our community, and it is something that we will continue to work on. So it's not about to fall off the radar anytime soon for either of us. The last thing that we have on here is in the works is coordinated entry. Salt Lake City is in the midst of building out a coordinated entry system. Right now we are a no wrong door approach, and individuals can access through a variety of points, but there is no coordinated entry system in place at present time. And so I think it's important for both homeless service providers and community action agencies to be stakeholders in the process and to be at the table, which I think both Michelle and I are committed to do. And then we also see a number of ways in which we can collaborate and support one another in this process. Michelle, did you want to add anything on coordinated entry?
Just the coordinated entry system is a model, again, where we can prevent or divert people from homelessness as much as possible and reduce entries into homelessness. We've had a pretty robust coordinated entry system into our housing programs for a number of years, but with the new model of multiple shelters coming on site, we want to make sure that we have a system in place that connects with people as early as possible, and when they truly need shelter, that they're sent to the right location, and that all folks have equal access to the housing and supportive services that they need.
Absolutely.
That's it.
If we move on to the next slide, I think I just want to wrap up by saying, as a community action agency, I truly think it's imperative that we are reflective of the services that we are providing in our communities and ensure that we are meeting the needs of our community. And that entails sometimes making course corrections midstream. We can't always wait till the end of a funding cycle or wait till another program comes into play. We need to make sure that we're in the game and that we're in it for the long haul and that we're there supporting the needs of our community. And as we're moving forward, as everybody knows, and I'm certain everybody on the call is experiencing this, funding is getting a little tighter, and we're starting to compete against one another for the same funding streams. And that is going to entail that we start to collaborate more effectively together and more efficiently as partners in our communities, that we're more data-driven, and that we also need to be more flexible and think outside of the box. And sometimes that means finding new innovative practices, and rather than following the road that's already paved, it means we get to pave those roads for others to follow us on. And so with that being said, I think we have here at Utah Community Action, we have a strong, viable partner in the road home, and we were looking forward to continuing to build those roads and continuing to move on within our community and ensure that we are meeting the needs in the most effective way that we know how to. So thank you for allowing us the opportunity to share with you today. And we'll open it up for questions.
So we have one question that came in, and our participant asked, can you please describe the situation wherein diversion was unsuccessful and why?
Sure. So in terms of some of our diversions that have been unsuccessful, what we're seeing is oftentimes we're identifying a home in which a family can go to, or actually the family's identifying a home in which they can go to, or a support system. And sometimes the relationship, maybe the barriers or what have you not, what's happening in the household is not conducive to meeting the needs of the family. We see a number of our families coming back to the shelter during the summer months, meaning that the children are out of school and they are in the household with that family, which we know also provides a little bit more challenges in itself because the children are there and not in school. And so also being mindful of how can we engage those families and better support them. So we are seeing a little bit of that. We're also just seeing some instances in which we are diverting families and, you know, maybe the situation in which they were diverted to, it just didn't work for whatever reason and they are coming back to the shelter. But like I said, it's within those first 30 days that they are often coming back and they're oftentimes identifying barriers around the support system and also around employment.
Thank you, Jen. We have another question, or a comment and then a question. It sounds like you have a great partnership. What advice would you give to other community action agencies interested in developing partnerships with the homeless system in their community about how to get started?
My first piece of advice would really, oh, go ahead. Go ahead, jump in.
No, this is you, Jen, but the one thing I was going to say that I think is so beneficial is to find out when these community meetings are happening and to just be present and take part and learn and be at the table. I think that leadership at Community Action that came into play a few years ago has really done that, and prior to that, those connections really weren't there, and it's important to be around the table when community planning is happening around homelessness.
I completely agree with that, and I think also what we learned early on with our launch with Palmer Court and implementing our early Head Start and Head Start classrooms there is it was just a matter of reaching out and figuring out how we could better support one another. And I think really establishing strong partnerships and relationships with those within your community is so necessary and critical to the work that we do. And as Michelle said, yes, you absolutely do need to be at the table. You can't just be in the room. And sometimes, you know, I think getting into homeless services as a whole was something that was new for us as an agency, and I would like to claim that we were probably naive moving into it. We have learned a lot over the course of the last 3 years, and I thank Michelle for being there for me through that time. But sometimes it also means trudging into waters that we aren't necessarily used to, and that's okay. But reach out to your partners and make sure that you really establish strong relationship with them, and there's always ways that we can meet and give and take on both ends.
Thank you. And we have another question. How are you working with DV agencies or agencies providing employment services? I think.
So with domestic violence agencies, we have 2 domestic violence shelters in Salt Lake County, in addition to the family shelters that we operate. And we work very closely with them to try and ensure that families who are in danger can stay at one of those facilities. They are often full, and we have seen more and more that we are serving as an overflow to the domestic violence agencies. So in our family shelter, our main family shelter, we have one of the domestic violence agencies, South Valley Services, comes on site a couple of times a week. Our case managers refer clients to them. They offer classes on site at the shelter, and we are moving forward with implementing a collaborative lethality assessment protocol, and diversion is definitely part of that. I know that they ask questions around this issue in the diversion process. We're just rolling that out, and it will help inform how we bring in specific needs and how we can keep each family safe within our programs.
Thank you. And we have a couple more questions. Are you willing to share guiding documents that help shape the development of your program?
Absolutely.
Yeah.
Anything that we have on hand that could be of help to other agencies, we'd be more than happy to share.
Yep.
And we have another question. For community action agencies wanting to do more with programs serving homeless families, where would you recommend they reach out? Anyone in particular? Examples for needed entry, shelter.
You know, we started looking at the services that we had in-house already. So we already had some prevention dollars that were housed with the agency. So we started where we were, and we met with our funders, so for the majority of the funding for that was county and state funding at the time. So we started to meet with them, and then of course we met with our providers. I think too, sitting down and just having the opportunity to sit down with Michelle and Melanie and talk through the services that they were providing, also the services that they felt like were needed, was really what helped guide us. So it wasn't necessarily us walking in and saying, hey, we have a plan, we're going to hit the ground running. You know, it was, hey, this is what we're thinking, this is what we've seen. Diversion left a really, was impactful. I really feel like there's a place for it within the community. What are your thoughts? Do you think that is something we could launch? And so it was more of a collaborative conversation from the get-go than us identifying where we wanted to fit in terms of homeless services, if that makes any sense.
And we have another question. A lot of CAP agencies provide emergency assistance, eviction prevention. Any recommendations, for example, how to better use those funds in conjunction with homeless services?
The first thing that comes to my mind is really just looking at the system and ensuring that you are utilizing your prevention dollars in the best way that you can, and also truly being mindful of the best practices that are out there. I think community action agencies are truly known for a lot of work around prevention, but I would say I was naive to what was happening in terms of homeless services, and it really took educating myself and becoming more familiar with the systems that were put in place and the resources that the Alliance has online to help guide some of the programming and shifts that I wanted to make for the program. Michelle, do you have thoughts on that one?
Well, I think I agree with everything you said, Jen. I think, eviction prevention is different than homelessness prevention, and with such a scarce amount of dollars, from the homelessness community perspective, there are particular things to focus on. The studies that we did, showed that eviction prevention doesn't necessarily correlate with homelessness prevention, and so really investing in diversion has been one place I think that we've been able to utilize that kind of support, and connecting those homeless prevention dollars with families coming out of homelessness, with families in rapid rehousing programs, families who were formerly homeless, in a prioritizing way, I think is another good place that we focused.
Mm-hmm.
So does anyone have any other questions? If you do, please feel free to put them in the chat box. And it doesn't seem like we have any more questions, but if you do put in questions, we'll make sure to forward it to our panelists, and I'm sure they'll be more than happy to answer them for you. So with that, I'll hand back to Jen Saunders.
Thanks, Lisa. And you wouldn't mind going to the next slide. Thanks. So I'm just going to take a moment to talk about HUD's 2017 Continuum of Care Program, NOFA. For those of you who are not familiar, HUD's COC program is an annual competition for homeless assistance funds through a NOFA process. If you could go to the next slide, please, that'd be great. So the program NOFA program NOFA registration notice was released on April 10th. The actual NOFA hasn't been released, but the registration notice gives us some information about what will be in the NOFA. We're assuming it will be released towards the end of May sometime in June. And while we don't know the funding available yet, as Congress has not appropriated funds for this program, HUD will provide some information about this at a later date. The registration notice provides information necessary to register COCs, as well as information as to what will be in this year's application, including what new projects you can apply for. So next slide, please. So what we're finding is that the 2017 registration notice is mostly the same as last year's, focusing heavily on HMIS data and the submission of system performance measures. As in past years, the funding that COCs can apply for is divided into tiers, with projects prioritized in Tier 1 being more likely to be funded than projects of lower priority that fall into Tier 2. And communities are also expected to have a performance-based project review and rank process. Next slide, please. In the program notice, HUD's 3 high-level priorities are identified. The first is creating a systemic response to homelessness by developing systemic supports that assure homeless assistance is well-coordinated, well-managed, inclusive, transparent, and achieves positive outcomes. The second priority is strategic resource allocation based on performance evaluation and data from resources. And the final is using a housing-first approach to move individuals and families quickly into permanent housing. Next slide, please. As discussed here, funding for new projects available are all for permanent housing, permanent supportive housing, rapid rehousing, and joint transitional housing and rapid rehousing projects, which is a new type of intervention. And I know Michelle and Jen already spoke about some rapid rehousing and PSH earlier during the presentation. So what's important to CAP agencies? There's new funding available, and the reallocation process can also yield funds for new projects. Depending on the amount of funding available and the 2017 appropriation, HUD may continue the permanent housing bonus. So just to let you know, if you're interested, we are planning to produce webinars and resources in the coming weeks to help communities prepare for the NOFA. And with that, I will turn it over to Jared, who will be talking about some of the advocacy work. Thank you.
Hello, I work on the Alliance's advocacy team, and so in order to get you all the resources that we need to make sure that these programs are running effectively, it's important that we continue to push in front of Congress what our priorities are and the importance of these programs. So first, to give a little bit of context, currently Congress and the federal government is operating under a continuing resolution, meaning that funding levels have stayed the same from fiscal year 2016, but that continuing resolution ends on April 28th, which if Congress doesn't act, the government will shut down. Right now, what we're looking at is, things look promising for the potential of spending bills to be passed and a new budget for fiscal year 17 to be put in place and enacted, but there's still a good chance that there might be a continuing resolution and the outside possibility that the government could shut down. Both of those scenarios would hurt these programs and would result in a lack of funding that we really need. So what we are going to be doing and what we need from you all is to help us make sure that Congress knows how important it is to finalize those spending bills and to pass them and to pass a clean budget for the rest of the fiscal year 2017. So what you can do about that is, first of all, Congress is currently on recess through the rest of the weekend, and that means that they are in your districts, and a lot of them are going to be holding town halls or meetings, and this is a great time for you all to connect with them or connect with their staff. You schedule in-district meetings in their offices. If they are holding town halls, go to them and speak up and make sure that you make the point that these programs are essential for your community. And then next week, it's going to be important to follow up with that or to reach out through calling and emailing your members of Congress so that they know what your priorities are. We in the Alliance have developed some tools that will make this whole process a lot lot easier for you all. If you go to our website, or if you click on the link that is in this slide, it'll take you to our page, our advocacy page that has all of the tools that we need, that you need to get all of this done. So it'll help you find your members of Congress. It'll help you find out what to do when they're in district, where to find their town halls, what kind of questions to ask. A lot of the messaging and the scripts and the call scripts and email scripts that are there are mostly tailored towards McKinney-Vento funding, but all of them are able to be edited. You guys can include your own community's priorities, which is actually important for those members of Congress and the people you're reaching out to. It's important for them to hear a local perspective and get that personalized data as well. And you can go on to the next slide. So going forward from that budget, however, it's important that we also recognize that Congress has begun work on the fiscal year 2018 budget as well. Many of you have probably already heard of President Trump's skinny budget that was released last week, with pretty substantial cuts proposed to both HUD and HHS, a little over 13% for HUD from the fiscal year 2016 budget, and just under 18% for HHS, including the elimination of the Community Services Block Grant Program. So both of these, it's unclear what Congress is going to do specifically, how seriously they're taking that budget, but what's important to know is, regardless, it shows some serious concern and a little bit of urgency for us to take action. So a couple things. First of all, it just makes it more important that we act now for fiscal year 2017 to make sure we maximize what we can get in this year's budget, but also to show Congress that there is a big constituency for these programs and people that care about them and people that want to take action on them. We'll send a message to Congress that they need to pay attention to that throughout 2018 as well. So continue to call, email your members of Congress throughout the year. And a big part of this is going to be reaching out to your local community and getting your mayors and city council members, other programs that are similar to you that have similar interests, getting them on board. The more that you can create a community network of people that are willing to advocate, the more you're going to be able to amplify your voice, the more that Congress is going to be forced to pay attention to these programs, and the more likely we are to make sure that we protect them, regardless of what happens with the fiscal year 18 budget. So all that's kind of where we are now. The biggest thing that we can help you with is if you go to our website, go to our click on Contact Your Representatives or the link that we provided here. Look at those tools, explore. We've got a lot of talking points. Sign up for our advocacy alert, and we'll keep you posted on different developments and events that are coming up, and help you out with reaching out to Congress and making your voice heard in front of them. And we can do whatever we can to help you out. So.
Great. Thank you so much, Jared. So I just wanted to let you know that the Alliance is always looking for more information about community action agencies that are doing innovative work to address homelessness. So I wanted to provide my contact information here. Please feel free to email me with any information about your program. We'd love to hear from you. And also, if you're interested in learning about our soon-to-be-released resources for preparing for the NOFA, if you're interested in us doing a webinar focused on this, as well as some of the advocacy work that Jared discussed, please do let me know. And so with that, I'll turn it back to Lisa.
Thank you so much, Jen, and thank you so much to our presenters who gave us such insightful information. So just a couple things that we'd like to show you and keep you on your radar. We have some upcoming webinar event dates on May 24th and May 25th. May 24th, we have a Financial Empowerment for Families webinar, and on May 25th, we have a Trauma-Informed Approaches to Alleviating Poverty. And you can always register by clicking on any of the registration links that we provide to you after this. And just remember, this webinar is recorded, and we will have the presentation slides and the recording to you no later than 2 days. So we have another webinar series that is very new to our Learning Communities Resource Center, the Health Intersections. And we are trying to connect health and community action. And so the first webinar will be about social determinants of health. And you could read more about it when we send out our newsletters. Again, we have our May 24th webinar, Learning with the Learning Community, Financial Empowerment. On May 25th, we have trauma-informed approaches. And we would love to receive your feedback on how the webinar went. These links will all be provided to you after the webinar, so don't worry if you don't have them down. Here's our staff contact info. If you have any questions, any content-related questions, or any suggestions, please feel free to reach out to us. And don't forget that we have an annual convention coming up in August in Philadelphia, and we'll have lots of information and activities for you, and you can register online. Thank you very much. With that, I will ask Hyacinth if she has anything to add. And I guess she doesn't. So thank you, everybody, for joining us. We'll make sure to have these presentation slides and recording available to you on our website and blog. Thank you so much.